Hello, I'm Forrest Mahan, President of Aiken Technical College, and welcome to the next edition of the Mahan Conversations. Today, my special guest is Dr. Brian Logan, who is the Dean of School of Health Science. Dr. Logan, welcome.
Thank you.
We wanted to talk to you today about some of the great programs we've got going on in your area, but in particular, we wanted to talk about a program that our students can take completely online. So tell us about that program.
Well, first of all, thanks for having me, and I'm always grateful to having an opportunity to come out and talk about the various programs that we have in the School of Health Sciences, and some of the opportunities that we have for our students and what we can do for the community. Medical coding is a very interesting program that we have. It's the only program in the School of Health Sciences that you can do the whole thing completely online from home or work or wherever. You can take your prereq courses. Typically, students take one semester of, it's a basic English, basic math, and a anatomy and physiology course. Do that. And then if you're successful there, you apply to the program, and then it's a 3-semester program. It's basic. Technically, it's health information management is what the HIM is what those courses are, but it's medical coding is the term that most people use, and it's a job that a lot of people do from home anyway and online. So we thought a couple years ago this program was it just wasn't doing as well as we thought it could be. And Crystal Treason, who is the program director for that program, she's also our medical assisting program director. She wanted to take hold of that program and make some changes, and she came up with the idea of, hey, let's do this online. Most of the stuff's online anyway. When you have this at the jobs, this might be a perfect opportunity. We went from having 5 or 6 students in that program over the years to almost, in the past 2 years, the cohorts that came through, we had 30 students in there, which is packed.
Now, when you say, the jobs, what type of job would they get with a medical coding degree?
That's a good question. So it's very interesting. That profession, so I used to be a chiropractor, and I had a pretty big practice down in South Georgia for about 10 years. This was back in the late 90s, early 2000s. And you really didn't have a lot of medical coding type stuff. I had an office manager who typed out on a word processor EOBs with codes for diagnostic
What's an EOB?
procedures. It's an exclamation of benefits.
Okay.
And so what that means is, when you go to the doctor, there's a code for your diagnosis when you're sick or whatever, right? And whatever illnesses you have or the reason that you're there. And there's also codes for the procedures. And that's how doctors and clinics and hospitals get paid. And so when you send in these things, like I said, we used to type them up and then we would mail them in. And then sometime around probably, I don't remember, 2005, 2006, they wanted them to start having them electronically. So then you start doing stuff on the computer. So now you've got the internet involved and you've got computer stuff going on. So you're typing them in there and sending them electronically. And so this kind of opened the door to this medical coding thing. So now why don't we source that out? I don't have to hire somebody to sit in my office and do it. I've got somebody over at another place or at home or wherever if they have internet and Wi-Fi, which wasn't huge then, but as the technology grew and the requirements through the insurance industry changed, then this kind of just really blew up this profession. And over the years, a lot of people don't know about it. They don't realize that this is there. It's a unique profession. A lot of people do it from home. A lot of people go and work in the doctor's offices and do a certain amount of this type of stuff. It's a great entry into this whole health information business profession. And so with a certification from Aiken Tech, you could go to a university and get a bachelor's degree in health information technology or management. You can get master's degrees in that. People work in hospitals that run these parts of that's a big part of the industry of healthcare is getting paid from insurance companies.
So basically, as you've shared, this program for our students who enroll can do this completely remotely. They can do it at home or on the road or wherever they are, and then they can get their credential and then get a job that more than likely would also be remote work, correct? They could work from home, is that correct?
It can, yeah, it could be. That's what a lot of them are doing right
now. Now, a lot of that seems to be in response to what we saw as we come through the COVID-19. This entire college had to go remote for about a year, and a lot of services went remote. And as people have gone back to work, we've seen some of our courses have evolved into hybrid courses where they do some of it online and some in class. and then we've seen some classes come back completely on ground, and then now we have this one program in particular that focuses on just the online component. Do you think potentially there could be expansion of other programs to fully online opportunities?
Well, you're exactly right. So that was sort of the impetus to start looking at the online thing. Where are the areas within what we do in the School of Health Sciences that we could take advantage of that? So just for example, my background is the anatomy and physiology stuff. Before COVID, we never imagined in a million years we'd be teaching an A&P class online because of the lab component. So we had some hybrids before that where you could do online stuff with the lecture portion, but you had to come to lab, right? That's what we thought. Well, when we were forced into looking at other options because we had to go online when COVID hit, we started looking around and we realized, you know what, there's a lot of technology out there where you can actually do this interactive lab stuff, and it was better than what we were doing in lab. And it's all online, it's all computerized, it's three-dimensional models, and it's really cool. And so, and it wasn't really expensive. And so we jumped on that and we used it during COVID, and we came back and we're still using it. So now what we do is we offer a little bit of everything. So we'll have a traditional face-to-face because some students need that and they like it. We also have hybrid where they do one part of it online and one part they come to campus, which is also a good format. But then we also do completely online for those. Now the problem that we run into with the other programs, a lot of what we do in health, in the School of Health Sciences is skills, hands-on skills-based stuff. So when you talk about surgical technology or something, now you can do some of that stuff online, the hybrid coursework, and we do, but you're going to have to come to campus for some of those things because you can't learn how to be a surg tech, online. I mean, there are some things that you can do.
And some of the programs too require clinical visits and such like.
You got to get out, and you got to go to clinic, and you got to.
And so in those instances, medical coding is unique in that it is something that you said could be completely done online.
And it's working.
And it's working. Well, what other benefits are there? In other words, you could do it from home or remotely, but what does online learning do in terms of helping students achieve their goals? What are the benefits to being in an online program?
Yeah, so, what we're learning is, as we have gone through this over the past few years, is the one thing is it's not for everybody. That was, some students really need that hands-on sort of, the face-to-face stuff. So, if you're not proactive and you're not, somebody who can manage their time wisely, sometimes, doing too much online is not always a great thing. But for most people, they love it because what it allows them to do is it allows them to be at home with their kids or work, have a full-time job, and you can work on your own schedule for your school. You can come home and do things at midnight or something. I mean, you don't even have to be online at a specific time for these classes. They're fully online. You can do the work whenever you are available. There are deadlines. We have to hold you to a certain, the amount of accountability as far as weekly assignments and that kind of thing that go. But if you need to do it when you get off work, if you need to do it after the kids go to bed, I mean, it's a great opportunity for somebody who just really thinks that they don't have time to go to school, and be here on campus and drive here, the world we live in now, things are getting expensive. So this is a great opportunity for somebody that needs that flexibility there. Another great thing about it is with this particular medical coding degree certificate is, like I said, you get that degree, you start working, you can still work from home, make money, and then continue on with your education, because a lot of this health information management stuff that you can get a bachelor's degree, master's degree, and get even higher paying type positions in hospitals and clinics, you can do a lot of that stuff still online too at the university level. So it's a great way to enter into that field.
You mentioned, say, 30 people in a cohort. What's our placement rate? We always are going to be, evaluated on, do our students get jobs? Do they go on to the next degree? What is the placement rate for that program?
I was talking to Ms. Friesen about that today, as a matter of fact. So we are still tracking that. We're on our second 30-person cohort coming through on this program. And so she said for the most part, about 50 to 60% of the students are following through getting their certification. You can still get a job without the certification, but most places want you to be certified. So not all students jump in and get certified immediately. Some wait. So we've had some struggles trying to find people and find out what they're doing. So we don't have any real concrete, hard and fast numbers. Now, the job placement, there's been across the board with health professionals, programs and jobs. The forecast with the U.S. Labor Bureau statistics, 30% growth. So there's so many jobs out there. You mentioned something this morning about the nursing. It's 190 something jobs.
Well, there are more jobs than people in the region and the CSRA.
And it's like that with everything. It's like that with medical coding. It's like that with Surge Tech. We live in a unique time and place. It's around South Carolina as a state, Aiken as a county, the CRSA as a whole. We've got a growing elderly population just with the baby boomers in general. A lot of people retire to this area, and so even here it's just even more of a demand. And so nobody's having a hard time finding a job if they want to get it. But you got to get the education, you got to get the skills, you got to you need to get certified and those types of things. And so that's the important thing. We can give you the education and we can give you the knowledge, and the jobs are there. There's plenty. They're getting their jobs. There's no shortage of that.
If someone's watching this, or they know of somebody who may be looking for that next career, when would be the next time they could enroll in the program?
So for medical coding, we accept applications for example, for this fall start. It starts every fall. We accept them up till probably the middle of the summer. So it's you can once you get those prereqs knocked out. We accept applications almost right up to the beginning of the semester starts. So it's not overly competitive. We've got plenty of spots. It's online, so we don't have to worry about seats. Sometimes you have programs where you only have 20 seats for a lab or something, so we can only accept 20 students. Well, we don't have that problem here. So we can let this thing grow. We can split it out into two separate groups if we need to, if it gets overwhelming, and then we have opportunities to hire more faculty to come in to help if we need it. So this program can really just grow as big as we wanted to get. And so we don't. If you pass your prereqs, it's not overly competitive like some of our other programs. So we're accepting people, right up to the last minute. A lot of times, if you have what you need to get in. So it's come on and we'll look at and see what you got, and hopefully let you get in. And there are some required courses that we call prerequisites to apply to the program, but we are very flexible with those things as well. So I might have somebody that comes in and they'll say, well, I took these classes 5-6 years ago, or I have a bachelor's degree already in this or that. We make exceptions, and we have a lot of flexibility there. We just want to know that you're prepared to be at the level that you need to be successful in that program. So there's lots of options. There's ways to substitute certain things. We have students that come in with prior experience and different things that we take into consideration too. So the thing that if this is something that you or somebody that is interested in, what I'd say is give us a call. They'll send you to me probably, which is great, and I'll be more than happy to talk to anybody and see where you are, where you need to be, and what you need to do to get in. Most folks walk in right off the street, and you're able to do the whole thing in a year.
Very good. You can also check out atc.edu, look through our different programs, and then the enrollment center is available, and of course they can direct them to you or Ms. Dreesen to talk a little bit more detail about the program itself. Now, when we say School of Health Sciences, medical coding is that online program that gives people that asynchronous opportunity to learn whenever, wherever. But what other programs in the health science would you like to maybe say we've got? There's demand for all of it. What would you say would be a program that, if maybe not medical coding, what else might there be of interest in health sciences?
Oh, well, we have 7 programs altogether. So we have surgical technology, and that's a huge demand. They're all in really huge demand right now with the healthcare stuff. Surge techs work with surgeons in the hospital doing surgery, and they get certified as sterile processors as well. So which is another profession. You can get just a certificate in sterile processing without completing the surgical tech program, still get a job working in that area. We have radiological technology. Those are the X-ray folks. That's a great opportunity. It's very competitive, but those are the folks that go out and take x-rays. You can also get certified to do MRI and CAT scan and some other diagnostic imaging type things. We have medical assisting. Those are the folks, that's a very general area where you could work in a hospital, you could work in a doctor's office, you can do all kinds of different things, front office, back office type stuff in clinics. That's a popular program. We have EMS, EMT, emergency medical technician. That is a huge need right now. If you watch the news, and especially around Aiken, there's been talk, there's a shortage nationally for emergency medical service folks. So we really want to get people in there, and we have an excellent program here for that. We also have a pharmacy technology. So you can work in a pharmacy to do help the pharmacist fill prescriptions. And dental assisting. Expanded dental assisting is another very popular program that we have. That's not your dental hygienist. A lot of people get confused about that. Those are the folks that clean your teeth, and they have a big program there at Augusta University for that in the dental school. What the dental assistant is, expanded duty dental assistants, what we call them, and they are the folks that work right beside the dentist when they're doing dental procedures. So there's a lot of dealing with instruments and learning how to do those kinds of things. And that's another big demand. We have a shortage in this area for dental assistants right now. My stepdaughter is a dental assistant, and so I kind of know a lot about that, and she loves it. That's a very apparently a satisfying job. She really enjoys what she does, and we get phone calls. We get phone calls every day from hospitals, doctors' offices. They need medical assistants. They need surge techs, man. They need dental assistants, and so this is like just really right now is a great time to enter into healthcare. I mean, it's and another thing too. I always just want people to know it's like a lot of these things are just the beginning for most people. I mean, we have a lot of folks that come in for dental assisting again. So they may be a dental assistant, and they'll say, you know what, I love this. I want to be a hygienist, and they'll go be a hygienist. Dr. Williams, our dean of nursing, her son is looking into actually going to dental school. He was a dental assistant here, and now he's preparing for eventually to become a dentist. So we have, and we see it. We've had lots of folks come through here. We had a student a couple years ago that did medical assisting, and she's about to finish up physician's assistant. So she actually parlayed that into a PA degree it took her a long time, but she worked at it, and that's where she started. And so that kind of got her foot in the door. And so lots of opportunities for growth in all these areas. Lots of opportunities for jobs. They're needed. You're not going to have a problem getting a job, and they're paying. The demand goes up, so does the pay, and so we're seeing a rise in salaries all across the board with each one of these programs. So, and there's lots of opportunities there for scholarships and different things to help pay. The state occasionally will come out and help us with some areas to help students out financially. So, it's a great time to be, entering some of these fields. Well, we've got spots, so we're ready.
Well, I mean, if you're interested in any of these programs, I mean, check us out online, come and visit, and we can show you around the health science building. And again, great opportunities here right in Aiken County and the surrounding areas. And again, as you said, good paying jobs, some short-term training, maybe a little longer term, but also the idea of the stackable credentials. Start with one level, go to work, and then work your way up and continue your career pathway. Anything else you'd like to share about the School of Health Sciences?
Oh, no. Like, as Dr. Mahan said, my door's always open, and if you call the college and tell them you're interested in something in healthcare, and they'll send you to me, and I will reach out to you either through a phone call or email or whatever. And if I can't answer the question, I can get you in touch with a program director who can give you the details that you need. But typically, I'm able. You can come in, we can take you for a tour, we can sit down and talk and advise you on that, and talk about all the different programs and find what might be, what's the best fit for you if you're not exactly sure what you want to do. So, please, don't hesitate to contact us and come over and let us show you what we got to offer.
Okay. Well, Dr. Logan, thank you for being with us today, and thank you for giving us the overview of the medical coding online program and all the other various programs we have in the School of Health Sciences. Currently, we are getting prepared to get ready for summer registration, And also, it's never too late to get ready for fall, or too early to get ready for fall. So go ahead and reach out to atc.edu. Give us a call or come visit us in person. We'll be glad to show you the facilities and help you match the program that best fits your career needs. Again, Dr. Logan, thank you for being here.
Thank you.
And this has been Forrest Mahan with another Mahan Conversation, and we'll see you next time. Thank you.